Welcome to Something to Talk About from the Bainbridge Island Senior Community Center. We're going to be talking with Julie Rogers today from Paulsbo Fire about a program called Fire Cares, which aims to respond to behavioral needs in our community on the fly and over time. And we'll learn more about the importance of this program and how it helps fire and police staffs in our communities as well. Before we do that, though, I want to thank Fieldstone Communities of Bainbridge Island for offering to sponsor Something to Talk About. Fieldstone has independent living and assisted living and memory care communities. They have all of those, in fact, on Bainbridge Island, up on the Rolling Bay area, right around the corner from Bay Hay and Feed. To find out more, to learn about their day stay and respite programs, to take a tour, to be treated to a free meal, call Sierra Wood or Randy O'Neill. The phone number is 206-594-1010, and their website is fieldstonecommunities.com. Also, we are meeting on the ancestral homeland of the Puget Sound Coast Salish people, specifically our neighbors, the Suquamish tribe, who have been living against the waters of the Salish Sea since time immemorial. We honor them and are learning from their stewardship of these lands and waters. Julie, I want to thank you very much for taking the time to give us an update. It's been a couple of years since we did a podcast about Fire Cares, and we were talking last week with Kim Hendrickson about housing on Bainbridge, and she was saying that you are now coordinating a lot of this work for Fire Cares. So thanks for taking the time.
Of course. Yeah, it's my pleasure.
I'm wondering if you could tell us a little bit about sort of what the goal of the program is. And I think it's been in existence for about 5 years now. Here, there are also Fire Cares efforts across the country, I think. Is that right?
Yeah, that's true. So you probably already have a foundational knowledge of Fire Cares, but essentially Fire Cares was codified in RCW about 12 or 13 years ago, and some early pioneers of the program were Spokane Fire, Bellevue Fire, and Puget Sound Regional. And all of those models look a little bit differently, but our program here in Kitsap County was launched as a partnership between the city of Paulsbo and also the Paulsbo Fire Department, and that launched in January of 2021. And since has expanded into Central Kitsap Fire, and also South Kitsap Fire. So we now have 3 teams that are serving 5 fire districts across the county, with the Paulsbo team also serving North Kitsap Fire and Rescue. That's the Kingston, Suquamish area, Port Gamble area, and also Bainbridge Island.
So can you talk a little bit about what that service means? What kinds of supports are you providing?
Yes, of course. So the CARES teams are able to respond either on scene to support law enforcement or EMS personnel to help de-escalate crisis, to provide stability, immediate crisis intervention, to get people connected to supports and services, to advocate on behalf of patients and clients, and or to help liaise between DCRs, medical staff, law enforcement, and other services that are available in the area, essentially providing care coordination. We also and primarily do a referral-based follow-up service. So CARES teams get referrals from EMS crews and also from law enforcement, and then they triage and coordinate field-based outreach efforts within, based on acuity, 24 to 72-hour outreach to help, assess an individual's needs and formulate an intervention and get them connected to care. And that care could look like just care coordination that's activating existing systems of support, or it could look like case management, where we actually set goals with an individual and then we work with them to achieve those goals. So it's a longer term intervention than the police navigators typically provide, that our behavioral health workers are doing.
Yeah, and I know that we have a police navigator in the Bainbridge Police Department. Is that pretty much true in
Oh, yes.
all the jurisdictions that you're working with?
Yeah, so Kelsey Lynch is fantastic, and she's the navigator over there at Bainbridge Island. And then here in Poulsbo with Poulsbo PD is Josh Sutton. And then, of course, the county one is Casey Jinks, and he works with Kitsap County Sheriff's Office. And we work closely with all of those crisis intervention officers when we are working in the community because it helps give us a more robust intervention, but also it helps us not duplicate efforts.
Right. Yeah. Well, I think I know that often the first thing that will happen in any kind of a crisis, whether it is something that is an immediate situation or something that is more sort of long term, is that a call to 911. And
Hmm.
so that's where you talked at the beginning there about being able to go on scene to help de-escalate a situation. But many of those calls that come through 911 are not things that maybe require immediate emergency response by a police department or a fire department, right?
That's right. Yes.
So give me some examples of what that might be.
So in the north end, specifically Bainbridge Island, Poulsbo, and North Kitsap, Kingston area, those calls usually look a lot like geriatric needs, fall prevention, people who don't have adequate, resources and supports to meet their needs in the home, or they need more support to keep them safely in their home. So, 60% of the community in the north end that the fire cares teams are serving are geriatric populations that are people that are over the age of 65. And so those people may not, they may have a fall at home or they may have multiple falls at home, and it's low acuity, non-emergent. They call 911, they get a lift assist. And if crews are on scene and they assess that these individual could use some more support or has some stressors or barriers to care, then they would have a cares team. They would put in a referral for cares team to do a follow-up outreach with that individual. So that would be an example of something that's non-emergent, low acuity that we would follow up with after the fact. And
Hmm.
there's a lot of those in the community where people are very resourceful and they find ways to get their needs met. And so sometimes it's just a very chronic, chronic challenges with financial insecurity, housing insecurity, food insecurity, stressors related to employment, stressors related to domestic violence, stressors related to, a variety of things that we can help get them connected to that may not be urgent or acute or immediate.
Right. And I mean, I know that those of us who work in human services here at the Senior Community Center, and we work closely with Island Volunteer Caregivers, we try
Yes,
to identify some of those um, resources for people to use before they get in a crisis situation.
that's right.
But often what happens is that there is a point at which something happens, like you mentioned, a fall
Hmm.
that they can't get up from, or they're facing a crisis with their landlord or something, and it gets a little contentious.
That's
And
right.
so,
Yes.
and so at that point, they don't really know where to turn, and it might look like something that they feel they need to call police or fire, but your teams might be a better long-term research to try to figure out how to not make it happen again or work out what you can do to avoid having a recurring problem.
Yes, and it's somewhat of a reactive program, a reactive system, only because we don't have the staffing or the capacity to be able to take referrals directly from the community. So what happens is EMS has to be called or law enforcement has to be called first, and then we are responding to that to help alleviate the need for future 911 calls through that stabilization.
Right. And you may end up, I'm guessing, referring people to some of the folks who they could call directly, like the Senior Community Center or Housing
Yes.
Resources Bainbridge to get help with grab bars, or a social worker at Helpline House. And I'm just talking Bainbridge here, but
Yes, of course. No, Reed, you're exactly right. You are really identifying the key distinction between a co-response behavioral health team and community providers. Co-response teams are meant to immediately assess and stabilize and get them connected to community providers. So build a really organic, robust support network for that individual of connection through community providers. So there alleviates the need to call 911, and then CARES does not stay with them after that. So as co-responders, we're just assessing their need and getting them connected. Providers provide the ongoing support in the community. And so for Bainbridge Island specifically, we frequently use Island Volunteer Caregivers, Helpline House. We work closely with Kelsey Lynch. Knights of Columbus, of course, is critical. The
Right, the
Boeing
the
Bluebills.
Casey help and the supplies that they can provide.
That's right. And then actually all three of our teams use that service all over the entire county. It's such a critical service to the community. We also help people.
Then you just mentioned Boeing Bluebills, I think.
Yep, yep. Boeing Bluebills, we work very closely with them to help get people ramps built or installed, grab bars, a variety of household tasks and things that can help support them and keep them safe in their home. And then in addition to that, we help people fill out access applications and get them connected to transportation. We help facilitate primary care appointments and also you know, both the typical and atypical medical care, specialty care. We oh, we do. We have concrete goods that we carry around in our vehicle. So we carry grippy socks and, for fall prevention and medication organizers to help go through people's medications and make sure that they're current and that they're taking them the way that they're supposed to be taking them. So there's just a variety of things that we do. Also helping them to complete DSHS paperwork to see what types of long-term care or care that they can, qualify for Medicaid, Medicare, and caregiving, things like that, aging and long-term care through the county. So we'll do all the paperwork and all of the connections for things that people have difficulty navigating on their own.
And as you said earlier, you're doing that in response to some sort of a crisis call or a referral from the police or fire departments.
Yes, from a first responder. That's correct.
So since we're here, I would say that the other thing that someone might do if they're trying to look for that kind of help uh, is to go directly to somewhere like the Area Agency on Aging or a social worker at Helpline to help get assistance with filling out those forms, because we all want to make sure that you can do that. And CARES is a wonderful part of this response.
That's right.
So yeah. So how many people? You mentioned a few teams at the beginning in a hurry, kind of there.
Yeah, we have three teams of people. We have a team that's stationed here at Paulsbo Fire Department. That team serves the Paulsbo Fire Jurisdiction, Bainbridge Island Fire Jurisdiction, and North Kitsap Fire and Rescue Jurisdiction. We have a team at Central Kitsap Fire that serves unincorporated Kitsap, Silverdale, East Bremerton, and all the jurisdiction for Central Kitsap. And we also have a team at South Kitsap Fire and Rescue that serves the South County. The only fire department that is not represented by a CARES team or is not participating in CARES is Bremerton Fire, and they are a city system. That's a city fire department as opposed to the others, which are independent districts. And they contract for Common Street, which is it's a consulting firm that helps do outreach for homeless populations in the community. And so that's kind of how they address that problem currently in Bremerton and people's needs there.
So how are you funded? Um,
That's a
and
good
what are the
question.
risks?
Yes, so we are primarily funded through grants, competitive grants. Currently, we have been so fortunate to receive funding every year for several years from the Mental Health Chemical Dependency Treatment Court grant that helps provide staffing for our teams. We also are funded through the Healthcare Authority and the Kitsap County through a street medicine grant, and are working collaboratively with St. Michael's to onboard an advanced medical provider who can write prescriptions. And that person will be working alongside CARES in the community, in people's homes, and also with unhoused and unsheltered populations. And we are also so fortunate fortunate to receive co-response contracts with the Salish BHASO. And again, those are healthcare authority monies that are kind of passed through for the purpose of people who are working in these co-response systems. So those are our three primary funding sources at the moment. And sometimes, catch as catch can. We're always kind of looking to see what's available out there. But these monies are becoming far, far more competitive as people are recognizing how effective these types of programs are reducing people who are chronically utilizing 911 and emergency systems.
So is there any support from the participating districts?
Yes, absolutely. So our program currently is about $1.9 million to run annually. And this year for 2026, we are looking at about I was just crunching the numbers. We're just at about $800,000 in grants. So the rest has to be offset by the, participating fire departments, which is quite a hefty sum of money that fire departments are contributing to this program.
Right. And I recognize that that definitely is a burden. It also is a valuable way to stretch the response that they can offer too, right?
Exactly right. And I think the program the data tracking that we use through the fire systems and the emergency department demonstrates that people who are referred to CARES have a 68% reduction in 911 call and ED utilization, both who've received a CARES intervention. And that's 6 months pre-intervention is what we're measuring. How often they were calling 6 months before we had a CARES intervention up to 6 months after. And 6 months post-intervention demonstrates 68% reduction in 911 calls and ED utilization and that's averaged across all three teams.
Right. And it's going to be different for different people, obviously.
That's right. Yeah. So like some of the departments are demonstrating a little bit more, but when it averages out, it's averaging out consistently at 68% reduction.
Well, this is an absolutely wonderful program. I mean, I'm so
Thank you.
glad that it exists, and it kind of operates in the, outside of our range of awareness. So I wanted to take a time and talk to you a little bit about it. And
Thank you, Reed. I really appreciate that.
well, thank you for the work you do and the work in the team. So I appreciate you taking the time, and we will talk to you soon unless there's some last thought you want to leave our listeners with.
I think if people are coming into contact with 911 or law enforcement, and they think that they would benefit from increased support and or connection, they should request a CARES referral. That they can advocate for themselves when they know that that service is available to the community. If they're having contact, say, please refer it to CARES. I would like some more support.
Got it. So you have you have a situation where you're dealing with an EMT or a police department official. You also mentioned DCR,
Yes,
which is,
designated crisis responders.
and so if you're in a situation like that, you can say, I think it would benefit me if you could refer me to CARES for
Yep.
follow-up.
Yep.
Okay. Thank you, Julie. Talk to you
Yes.
later.
Thank you so much, Reed, for the opportunity. I appreciate it.
You're welcome.